Once again, we're here to explore another Republican conspiracy theory grounded in misinformation that places ideology over facts. It is the result of yet one more so-called investigation by the majority that has borne no fruit, despite consuming many months and untold hours of staff time, as well as the time of our federal agencies, not to mention many wasted taxpayer dollars. But just because their latest fishing expedition has turned up no evidence of wrongdoing does not mean that it is harmless. In fact, it is quite the opposite. By attempting to undermine confidence in the safety and efficacy of COVID-19 vaccines, their unsupported and disproven claims have real and devastating consequences to the health of our nation. Vaccine hesitancy is now growing, not just for COVID vaccines, but for other life-saving vaccines like RSV, measles, flu, and even polio. Let's remember how we got here. As of this week, 7 million people worldwide have died of COVID-19, including 1.1 million Americans. In January 2021, when President Biden took office, the COVID-19 pandemic was hitting its deadliest peak so far, with over 3,000 Americans dying every day. By February 2021, more Americans had died of COVID-19 than had died on the battlefields of World War I, World War II, and the Vietnam War combined. Thanks to President Biden's and congressional Democrats' decisive action on COVID, 3.2 million additional deaths from COVID-19 were prevented, 18.5 million additional hospitalizations were prevented, and $1.15 trillion in medical costs were avoided. These interventions saved lives. Let me say that again, vaccines against COVID-19 saved lives. But instead of accepting the overwhelming consensus of our nation's scientists and doctors, the majority has wasted 14 months trying to undermine the nation's confidence in these vaccines and to prove that they were rushed for political reasons. The mountain of evidence shows that they were not. In particular, they have alleged that the FDA bowed to political pressure and compromised its review of the Pfizer vaccine. But every witness they brought in as part of this investigation testified that it underwent a complete, thorough, and scientifically rigorous review. They made clear that the FDA did not approve the vaccine until it ensured that it was safe, effective, and of high quality. And their claims of so-called political pressure from President Biden to authorize booster shots for all Americans by September 2021, that didn't happen either. In fact, the FDA did not authorize booster shots for everyone until November 2021, after they concluded a complete and thorough review. Don't take my word for it. This is what the majority's own witnesses told them when they were interviewed. Dr. Peter Marks, the director of the Center for Biologics Evaluation and Research at the FDA, said, quote, "There were no corners cut with respect to safety or effectiveness or quality of these vaccines." Dr. Marion Gruber, former director of the Office of Vaccines Research and Review at the FDA, said that when the vaccines were authorized for emergency use in late 2020, quote, "I had confidence that the requirements as laid out by statute were met, and as I said before, may be effective and the known and potential benefits would outweigh the known and potential risks." Dr. Philip Krause, former Deputy Director of the Office of Vaccines Research and Review at the FDA, and a witness here today, said, quote, "It turned out the vaccines blew away those criteria. The vaccines were about 95% effective, and the lower bound was in the high 80s or even above 90% for one of the vaccines. And so the public could have very high confidence that those vaccines worked," close quote. Despite the rigorous and independent assessment by the FDA in reviewing these vaccines, the majority is providing a platform today to those who seek to perpetuate its campaign of mis- and disinformation about COVID-19 vaccines. It is bad enough that they are trying to undermine confidence in vaccines that were essential in bringing an end to the devastating COVID-19 pandemic. But their efforts have a far more pernicious impact. They are weakening support for a wide range of vaccines that have kept Americans safe for decades. Vaccines for measles, RSV, flu, polio, and for many other dangerous infectious diseases have been proven over and over again to be safe and effective. But a determined campaign against them have led to declining rates of vaccination throughout the nation. For example, after holding steady for a decade, routine vaccination rates for kindergartners have not yet rebounded to their pre-pandemic levels. This puts us all at risk. Congress has heard evidence time and again that these vaccines are safe and effective. We know that vaccinations reduce mortality rates, but instead of promoting public health guidance based on science and facts, House Republicans have joined efforts to spread misinformation with utter disregard for the health and well-being of their constituents. I urge my colleagues to retreat from this dangerous path.